Mysterious illness in children that may be linked to the coronavirus is turning up in more states across the country, and it's blamed for at least 3 deaths, and dozens of other patients have it in New York. Senior medical correspondent Dr. Narula talked to a mother in Illinois whose son became seriously ill.
It hit so quick. It was like 1 minute he was fine, and the next minute it's like he woke up with this weird, strange fever.
Sarah Garcia says her son Nolan's health went downhill fast earlier this month. At one point, his fever almost reached 105 degrees. When she couldn't get the fever down, she took her 6-year-old to the ER.
Did you have any idea what it could be with those symptoms?
I didn't know what it was, but my doctor had told me the only real virus going around right now would be COVID. But I was thinking, well, none of us are sick. We didn't go out, so I'm not quite sure, what this is.
Doctors told her Nolan's coronary arteries were enlarged, a sign often associated with Kawasaki disease. Hours later, Nolan tested positive for COVID-19.
It wasn't typical what you're thinking COVID symptoms. It wasn't a cough. He was not having a hard time breathing.
Nolan is one of more than 130 reported cases of pediatric multi-system inflammatory syndrome in the U.S. Hospitals in 11 states and D.C. say they have treated patients. In New York, where 93 cases are being investigated, officials are warning parents to watch out for fever, rash, and abdominal pain.
There's a spectrum of disease, and so what we're seeing here is probably just the very most severe spectrum of this presentation in children.
Dr. Sam Dominguez is a pediatric infectious disease specialist at Children's Hospital Colorado. He says there are several unknowns about this illness, including if it's linked to coronavirus.
This is a very rare disease, and we're working very hard at hospitals around the country to think about this and our best approach to caring for these children.
Some kids with this syndrome can get sick quickly. If you notice any warning signs, it is important to call your pediatrician. Dr. Dominguez also told us parents should not be afraid of hospitals, which can provide treatments children need at this time.
Very good to know. Thank you very much, Dr. Narula. Very scary.